Before starting an exercise program, or for any other reason getting much more physical activity, it would be a good idea for you to answer the questions on the Physical Activity Readiness Questionnaire, or PAR-Q. The reason for the PAR-Q is to make sure that there are no obvious reasons that a person should see a medical doctor before becoming much more physically active. Do keep in mind that the benefits of exercise far outweigh the risks, and the benefits include lower risk of early death, coronary heart disease, stroke, high blood pressure, adverse blood lipid profile, type 2 diabetes, metabolic syndrome, colon cancer, breast cancer, prevention of weight gain, weight loss, particularly when combined with reduced calorie intake, improved cardiorespiratory and muscular fitness, prevention of falls, reduced depression, better cognitive function. The health benefits of physical activity are generally independent of body weight. Adults of all sizes and shapes gain health and fitness benefits by being habitually physically active. The benefits of physical activity also outweigh the risks of injury and sudden heart attacks, two concerns that prevent many people from becoming physically active. So let's go over the 11 PAR-Q questions that I've put together from the Canadian Society for Exercise Physiology, the American College of Sports Medicine, and the University of Tennessee Department of Health and Human Performance. And as I read these questions, honestly answer yes or no to each question. Number 1, has your doctor ever said that you have a heart condition and that you should only do physical activity recommended by a doctor? 2, do you feel pain in your chest when you do physical activity? 3, in the past month, have you had chest pain when you were not doing physical activity? 4, do you lose your balance because of dizziness, or do you ever lose consciousness? 5, do you have a bone or joint problem, for example, back, knee, or hip, that could be made worse by a change in your physical activity? 6, is your blood pressure over 144/94? 7, is your doctor currently prescribing drugs, for example water pills, for your blood pressure or heart condition? 8, are you pregnant? 9, do you have insulin-dependent diabetes? 10, are you 69 years of age or older? 11, do you know of any other reason why you should not do physical activity? If you answered yes to any of the PAR-Q questions, you should see a medical doctor before becoming much more physically active and before you even have a fitness appraisal. Tell your doctor about the PAR-Q and which questions you answered yes. You may be able to do any activity you want as long as you start slowly and build up gradually. Or you may need to restrict your activities to those which are safe for you. Talk with your doctor about the kinds of activities you wish to participate in and follow his or her advice. If you honestly answered no to all of the PAR-Q questions, congratulations! You can be reasonably sure that you can start becoming much more physically active. Please note, however, if your health changes so that you can then answer yes to any of the PAR-Q questions, tell your fitness or health professional and ask whether you should change your physical activity plan. In conclusion, physical activity has many health benefits. Physical activity prevents or reduces the risk of many diseases and chronic conditions or disabilities. The benefits of physical activity almost always outweigh the risks involved in becoming more physically active. Pretty much everyone can start an exercise program and slowly build up to becoming much more physically active. In almost all cases, even if there are questions that you answered yes to, you will still be able to participate in exercise and other physical activity, although possibly with some restrictions or adjustments and special oversight by your physician. If you answered no to all of the questions, do start slowly, but don't delay. Get started improving your health by increasing your level of physical activity today.